News Talk on Samar News, your go-to podcast for the latest headlines and in-depth discussions. Join us as we unravel the stories that matter most, bringing you insightful commentary and expert analysis. Tune in for thought-provoking conversations that spark dialogue and inspire action. Stay connected with the news that shapes our world, only on News Talk on Samar News.
We're jumping straight into a really interesting topic today. The very latest on SARS-CoV-2 variants.
Yeah.
Specifically, there's a new strain that's starting to get quite a bit of attention, and, well, that's what we're unpacking.
That's right. We've pulled together insights from, recent reports, key data from the World Health Organization, definitely.
Right.
Plus some analysis from virology experts, and also what people are saying about national responses.
Right. So our mission today is to take all these sources, sift through them, and really pull out what's most important for you. We want to understand, what do we actually know about this new variant right now?
Mm-hmm.
Why is it being watched so closely? And what sort of questions are coming up about preparedness? Okay, let's get into it.
Let's do it.
So the variant we're zeroing in on is called NB.1.8.1. And the WHO, they've classified it as a variant under monitoring.
Yeah, and that variant under monitoring tag, it's important. It basically means the WHO is keeping a close eye on it.
Why that specific designation?
Well, it's usually because of factors like how fast it seems to be spreading, how quickly detections are rising.
Okay.
Even if it doesn't currently tick the boxes for, say, causing more severe disease or completely dodging our current vaccines or treatments, it's that growth signal.
And that rapid growth, that really seems to be the main trigger here, doesn't it? The numbers we saw in the sources show a pretty steep climb.
Oh, absolutely.
By late April 2025, NB.1.8.1 was making up something like 10.7% of all the genetic sequences being submitted globally.
Which is significant because just 4 weeks before that.
It was way lower, right? Like 2.5%.
Exactly. Only 2.5%. So that kind of jump from 2.5 to over 10% in a month, that definitely gets attention.
It really does.
And what's fascinating here really is just how quickly these variant dynamics can change. NB.1.8.1 is a perfect example right now.
Mm-hmm.
If you look at the WHO report, the one covering January to May this year, you just see this constant churn.
Right. Like, wasn't XEC the main one early in the year?
You got it.
And KP.3.1.1?
Exactly. Those were prevalent. Then, around February, XEC started to decline. And another one, LP.8.1, began increasing.
Okay.
LP.8.1 actually became the most detected variant globally by about mid-March.
Wow.
But then, almost as soon as it peaked, since mid-April, LP.8.1 detections has started to dip slightly.
And that's when NB.1.8.1 started its climb.
Precisely. As LP.8.1 declined, NB.1.8.1 surged. It just shows how incredibly fast this virus continues to evolve and find new ways to spread. It's a rapid turnover.
Okay, so given that rapid increase, where is NB.1.8.1 mainly being seen right now?
So the sources are reporting it's already the dominant strain in places like Hong Kong and China.
Right.
But it's definitely not limited to there. Its reach is wider.
Yeah, I saw it's popped up in several other countries too, identified in Australia, the U.S., suspected in the U.K., reports from Taiwan, France.
Correct. And the U.S. CDC reports they noted it initially in international travelers, people arriving at big airports, California, Washington, New York, Virginia.
Okay, so border surveillance picked it up first.
It seems like it. And since then, it's been confirmed in multiple U.S. states. The sources mentioned Ohio, Hawaii, Rhode Island specifically.
And beyond the U.S. and East Asia, what about globally?
Yeah, there are significant numbers being detected in the Eastern Mediterranean region, too. Countries like Egypt were mentioned.
Okay.
And also across Southeast Asia, Thailand and the Maldives came up in the reports.
Okay.
So even though it might be dominant in Hong Kong and China right now, its geographical footprint is definitely expanding and, relatively quickly, it seems.
That spread, it naturally makes you wonder, okay, what are its characteristics? Is it actually behaving differently?
Well, based on the early info we have from the sources, there are some, let's say, suggestions about its potential abilities.
Like what?
There's a quote from Laura Herrero, a virology expert mentioned in one source. She suggests that NB.1.8.1 carries multiple mutations that may infect cells more efficiently than earlier strains.
Okay, infect cells more efficiently. And I think the U.S. CDC reports kind of echoed that. Something about stronger cell binding.
Yeah, they did. The CDC report suggested NB1.8.1 shows stronger cell binding capabilities.
Which sounds like something that could, help it spread more easily between people.
It could, yes, potentially making it more transmissible. But, and this is really, really crucial, highlighted in the WHO's reporting, they have not seen any evidence so far.
Okay.
Any evidence indicating that this variant causes more severe disease compared to other variants that are out there circulating globally.
Right. That's such a key distinction, isn't it? So data might hint at easier spread, but the really important news from the WHO, at least for now, is no sign of it causing worse illness.
Exactly. That's the current assessment based on available data.
Okay. So given that, what about the symptoms? Are they different?
Actually, no. The symptoms described in the sources, they seem to line up very closely with what we've gotten used to with other Omicron subvariants.
So the usual suspects.
Pretty much. Common reports include sore throat, fatigue, maybe a fever, a mild cough sometimes, muscle aches, nasal congestion, that kind of thing.
Any mention of other symptoms?
The sources do mention that gastrointestinal symptoms, like stomach issues, can also occur in some cases. But overall, the symptom profile seems quite familiar, not drastically different.
Okay, so let's recap the picture of the variant itself. Rapid rise in detections, spreading geographically, potentially more transmissible due to mutations, but crucially, no current evidence it's making people sicker.
That sums it up well based on these reports.
And, whenever a new fast-growing variant like this emerges, it naturally kicks off these broader discussions about public health response, about preparedness.
Absolutely, and the sources definitely touch on that, including perspectives like points raised by Senator Bongo in the Philippines, for example. His comments frame this kind of situation, a new variant appearing as a necessary prompt to, review and maybe strengthen public health strategies.
Yeah, his core message, reading through the source material, was really urging health officials to be proactive, to take steps now to protect the public.
And the central theme that comes through is just the importance of being prepared, of knowing where the threat actually is.
Right.
He stressed needing a response that's, composed, based on facts, not panic, prioritizing preparation and keeping the public clearly informed as things develop.
He also asked some pretty direct questions, didn't he? Things like, what is the Department of Health's monitoring system actually doing right now? Is it enough?
Yeah, and are hospitals ready? If things were to worsen, are they prepared? And a big one, do our past vaccines still offer protection against this specific new strain? These are critical questions.
Absolutely. And there was also the perspective shared that, countries with open borders, lots of international travel, they could remain particularly vulnerable to new variants like this being introduced and spreading.
That makes sense. It highlights the need for ongoing surveillance.
And then transparency, right? That was stressed too. Open information sharing between countries was seen as essential.
Definitely. Along with some underlying concerns that maybe not all countries fully disclose their data in a timely way.
Which complicates the global picture.
It certainly can. And this whole discussion really feeds back into that bigger theme of long-term preparedness. Taking the, frankly, very tough lessons we've all learned over the last 5 years and actually institutionalizing them, making them stick.
Meaning what, exactly?
Meaning things like consistently basing public health policies on solid science, not just reacting, and making strategic, sustained investments in our public health systems, our infrastructure for the long haul.
Not just patching things up during a crisis.
Exactly. There's a quote summarizing this sentiment that really stood out. If there's one lesson we've learned from the pandemic, it's the importance of a timely, organized, and science-based response.
That says it all, really.
And it does raise a big question, I think, for health systems everywhere, not just in one country. How do we genuinely move beyond just reacting to the latest variant? How do we apply those hard-learned lessons to build systems that can truly anticipate and respond effectively to future waves, whatever form they take?
That's the core challenge, isn't it? So let's try to bring this all together quickly. We've looked at the emergence of this NB.1.8.1 variant, its really rapid growth, explored what we know or think we know about its characteristics, where it's spreading, and importantly, touched on these ongoing crucial conversations about health system preparedness that these developments spark.
And I think it's really vital we keep hold of that key distinction we found in the sources. Yes, its prevalence is growing fast. Yes, there are suggestions it might be more transmissible.
Right.
But the current information from the WHO does not indicate that NB.1.8.1 is causing more severe disease compared to other variants out there right now.
Okay. So for you listening, what does all this mean today? Well, primarily, it means keeping an eye on credible sources.
Yeah.
The WHO is obviously a key one for the latest updates on this and other variants. Stay informed about their recommendations.
Good advice.
And it also means just remembering that the basic public health precautions we've all learned over the years, they still remain relevant tools in our toolkit.
Staying informed, staying prepared. It's key.
Absolutely. And speaking of preparedness and those hard-won lessons, here's maybe a final thought for you to chew on, something building on that focus in the material on long-term strategy.
Okay.
As new variants like NB.1.8.1 now inevitably continue to emerge and we see these rapid shifts, from XEC to LP.8.1, now this one, how can we, all of us, collectively as societies and also individually, make sure that those really critical lessons in public health preparedness truly become ingrained, like deep-seated practices for the long term, rather than just, temporary reactions whenever something new pops up in the news?
That's a constant challenge, making those lessons stay.
It really is. We hope this gave you a clearer picture of what's happening with this latest SARS-CoV-2 variant, NB.1.8.1, and the really important ongoing conversation around global preparedness.